Hey there, I'm Dr. Caleb Sterling, and today I'm going to talk to you about something that's probably affecting you right now if you're over 60. You know that feeling when you stand up from your chair and your legs feel heavy? Or maybe you notice they swell up by the end of the day. Or perhaps your feet get cold even when the room is warm. These aren't just inconveniences. They're your body sending you a message that your circulation needs some help. Now, I've been working with seniors for over 20 years, and I can tell you that poor leg circulation is one of the most common complaints I hear. And here's the thing. A lot of people don't realize that there are natural approaches that can make a real difference. In fact, there's one particular oil that research is showing can improve blood flow to your legs remarkably fast. And I'm going to break down exactly how it works, why it matters for you, and how to use it properly. So stick around, because this could genuinely change how your legs feel by this time next week. Let me start by explaining what's actually happening in your legs when circulation isn't working right. Your circulatory system, your blood vessels, your heart, everything, is basically a delivery system. It's like the postal service of your body. When it's working well, blood flows freely through your arteries and capillaries, delivering oxygen and nutrients to every cell. And then your veins bring that oxygen-depleted blood back to your heart to get refreshed. But here's what happens as we age. The walls of our blood vessels become less flexible. They accumulate plaque from years of diet and lifestyle. Your blood can get thicker. Your heart has to work harder to pump. And your legs, which are furthest from your heart, are the first to suffer. They're like the last neighborhoods to get the mail delivery when the postal system slows down. When leg circulation gets poor, you experience several symptoms. Heaviness in the legs. That's from fluid buildup because the blood isn't moving efficiently enough to prevent swelling. Coldness in the feet. Your blood is carrying less heat to the extremities. Restlessness, especially at night. That's often because the muscles aren't getting enough oxygen. Tingling or numbness. That's nerve tissue not getting adequate blood supply. And in more serious cases, you might notice discoloration, slow healing wounds, or even pain when walking. The problem is, most people just accept this as part of getting older. They think, well, I'm 65, 70, 75. Of course my legs are going to feel this way. But that's not true. Your body has an incredible capacity to improve circulation when you give it the right tools. And that's where what I'm about to share with you comes in. Let me paint a picture of what poor leg circulation really means for your daily life, because it's about more than just discomfort. When your legs don't have good blood flow, you can't do the things you love. Maybe you want to take a walk through the neighborhood, but the heaviness and pain stop you after 2 blocks. Maybe you want to play with your grandkids, but you're worried about your legs giving out. Maybe you want to garden, or go shopping, or just stand in the kitchen while you cook without your feet aching. Over time, this doesn't just affect your physical activities, it affects your independence, your confidence, and honestly, your will to stay engaged with life. I've seen so many of my patients become isolated because circulation problems made it harder to get around. And then they sit more, which makes the circulation worse, which makes them sit more. It becomes a downward spiral. But here's what I also know. When we address circulation, we see these patients light up. They're back to their hobbies, they're more confident, they feel alive again. And that's what we're going for here. What science says about oils and circulation. Now, I want to talk about something that's getting a lot of attention in the research world right now, certain plant-based oils and their effect on blood circulation. And I'm specifically talking about oils that contain compounds called vasodilators. These are substances that actually make your blood vessels relax and expand, allowing more blood to flow through. One oil that's been showing really impressive results in recent studies is ginger oil. Now, I'm not talking about ginger flavoring for your tea. I'm talking about concentrated ginger oil with high levels of active compounds like gingerols and shogals. These aren't new discoveries. Ginger has been used in traditional medicine for thousands of years. But what's new is that modern science is proving why it actually works. When you apply ginger oil topically, meaning on your skin, the compounds penetrate through the dermis and reach the blood vessels underneath. They interact with something called the endothelium, which is the inner lining of your blood vessels. When these compounds reach the endothelium, they trigger the release of something called nitric oxide. Nitric oxide is like a relaxation signal for your blood vessel walls. It tells them to loosen up and expand. More expanded vessels mean more space for blood to flow through. More blood flow means more oxygen to your leg muscles. More oxygen means less heaviness, less cramping, less swelling, less pain. Research from universities in both Asia and Europe has documented that ginger compounds can improve blood flow measurements in the legs within 15 to 20 minutes of application. Some studies show continued improvement over several hours, and when used consistently, patients report reduced swelling
and improved leg comfort within 1 to 2 weeks.
But here's what I always tell my patients. Ginger oil isn't magic. It's not going to reverse years of circulation problems overnight. But it is one powerful tool in your toolkit, and when combined with other lifestyle approaches, the results can be substantial. Now, ginger oil isn't the only player on the field. There are several other oils that have solid research backing their use for circulation support. Cypress oil is another one I recommend. Cypress has compounds that stimulate the venous system. That's the system that brings blood back up to your heart from your legs. When your veins are working better, you get less swelling, less pooling of fluid in your ankles. Cypress oil also has mild astringent properties, which means it can help with that heavy, congested feeling in the legs. Then there's frankincense oil. Now, frankincense is famous for reducing inflammation, and poor circulation often creates inflammatory responses in your leg tissues. When tissues are inflamed, they swell more, blood flow gets restricted further, it's another downward spiral. Frankincense helps break that cycle by reducing that inflammatory response. Lemon oil is another one. It supports lymphatic drainage. Your lymphatic system works alongside your circulatory system. When lymph isn't draining properly, you get more swelling. Lemon oil helps activate the lymphatic vessels and get that fluid moving. And then there's helichrysum, which is sometimes called the circulation hero among essential oils. It has been shown in research to improve overall circulation and reduce the appearance of varicose veins, which many seniors struggle with. Now, the reason I mentioned all of these isn't because you need to use all of them. It's because different oils work slightly differently. Some are better for reducing swelling, some are better for that heavy feeling, some are better for pain. So you might find that one works particularly well for your situation. Here's where a lot of people mess up. They get excited about an oil and they either use it incorrectly or use too much, and then they wonder why it didn't work or why they got irritation. First rule, never apply essential oils directly to your skin undiluted. That includes ginger oil. Essential oils are concentrated plant extracts, and they can cause irritation, redness, or even burning on delicate skin, especially the skin of seniors, which is thinner and more sensitive. You need to dilute them in what's called a carrier oil. Good carrier oils for leg circulation work include coconut oil, which has mild circulation benefits of its own, jojoba oil, which is great for sensitive skin, sweet almond oil, or avocado oil. The general rule is a 3 to 5% dilution. That means if you have 100 milliliters of carrier oil, you'd add 3 to 5 milliliters of essential oil. If you're new to oils, start at 2% to make sure your skin tolerates it well. Now, how do you apply it? You want to apply the diluted oil to clean skin. The best time is actually in the evening because your legs have been bearing your weight all day. They're probably swollen, and this gives the oil time to work overnight. You'd massage it into your calves, your shins, around your ankles, basically any area where you feel heaviness or coldness. Use firm, upward strokes when you massage. You're not trying to be gentle here. You actually want to support the movement of blood and lymph upward toward your heart. Massage for at least 5 minutes, really working the oil into the skin and muscles. Some people use a small massage tool to apply deeper pressure. That's fine too. How often should you do this? I recommend daily if you're dealing with significant symptoms. You should notice initial improvement within 3 to 5 days. If you're using it preventatively, 3 to 4 times per week is sufficient. One important note: if you have any breaks in the skin, varicose veins that are very pronounced, or if you're on blood-thinning medications, check with your doctor before using oils. I'm saying this not to scare you, but because I want you to be safe. Now here's something really important that I need to say clearly. These oils work best when you're also doing other things to support your circulation. They're not a replacement for lifestyle, they're an enhancement to it. If you're using ginger oil every evening, but you're sitting on the couch for 12 hours a day, the oil is fighting against a much bigger current. You need movement. Even gentle movement, a 15 or 20-minute walk daily, some leg stretches, even dancing to music if that's something you enjoy. These all activate your leg muscles and pump blood through your vessels naturally. Hydration is another big one. Your blood is mostly water. When you're dehydrated, your blood gets thicker and moves more sluggishly. Many seniors don't drink enough water because they're worried about frequent bathroom trips. But proper hydration is non-negotiable for good circulation. You should be drinking enough water that your urine is pale yellow. That's your hydration target. Your diet matters too. Foods high in antioxidants, berries, dark leafy greens, beets, these all support vessel health. Foods high in nitrates, again, beets, and also things like arugula and spinach. These actually help your body produce more of that nitric oxide I mentioned earlier. Omega-3 fats from fish or flax help keep your blood flowing smoothly. Salt, on the other hand, promotes fluid retention and swelling, so you want to limit that. Compression matters. If you have significant swelling, compression socks or sleeves can help prevent blood and fluid from pooling. This is especially helpful during the day while you're upright and gravity is working against you. And finally, elevation. When you're sitting or lying down, elevate your legs above the level of your heart. This helps blood flow back up to your body without your circulatory system having to fight gravity so hard. When you combine these approaches with the oils, that's when you see real, noticeable changes. I'm talking about legs that feel lighter within a week, swelling that visibly reduces within 2 weeks, energy that improves because your muscles are getting better oxygen supply. So let me set some realistic expectations. If you start using ginger oil with a proper carrier oil dilution applied correctly, and you're also doing the lifestyle stuff I just mentioned, here's what you should expect. Days 1 to 3, you might notice that your legs feel slightly warmer, especially where you applied the oil. The warming sensation is the blood flow increasing. Some people feel a mild tingling. That's nerves waking up because they're getting better blood supply. This is good. Days 3 to 7. The heaviness should start to decrease noticeably. If you usually feel like your legs are dragging by 4 p.m., you'll probably notice that happens later, or doesn't happen at all. Swelling, especially in the ankles, should begin to improve. If you wear a certain size shoe and it's been tight in the evenings, you might find it fits better. Weeks 2 to 3. Continued reduction in swelling. The skin might look brighter, less dusky or discolored. That's because it's getting better blood supply. Cold feet might start warming up, even when you're not actively using the oil. You'll have more energy for activity. Walking longer distances becomes easier. Weeks 3 to 4. By this point, the changes are substantial enough that other people might notice. A family member might say, "Your legs don't look as puffy anymore." You might notice your shoes feel looser. You're able to stand or walk longer without discomfort. But I want to say this. If after 2 weeks you're seeing no improvement at all, this might not be the right approach for you. Some people have circulation issues that need medical attention. There are conditions like deep vein thrombosis or arterial disease that require professional treatment. If you're not seeing improvement, that's the time to talk to your doctor. Also, remember that these results assume consistent use. If you use the oil once and then forget about it for a week, you won't see results. This has to be part of your routine. I want to be really clear about this. While oils are natural, they're not free of potential risks, especially if you have certain health conditions. If you're on blood thinners like warfarin or newer anticoagulants, ginger can potentially enhance their effect. That doesn't mean you can't use it, but you need to talk to your prescribing doctor first. Your doctor might want to monitor your blood clotting times. If you have a history of bleeding disorders or are about to have surgery, hold off on ginger oil for at least a week before and after. If you have very sensitive skin, always do a patch test first. Apply a small amount of diluted oil to a discrete area like the inside of your wrist, wait 24 hours, and make sure there's no reaction before using it on larger areas. If you experience increased pain, increased swelling, redness, warmth, or any signs of infection, stop immediately and see a doctor. These could indicate a more serious condition. And here's the key one. If you have leg pain that's severe, sudden, or accompanied by shortness of breath, chest pain, or serious swelling on just one side, that's potentially a medical emergency. Go to the ER, don't wait. The oils I'm recommending today are well tolerated by most people, but they're not appropriate for everyone. If you have any significant health condition or you're on multiple medications, run this by your doctor first. They know your complete medical picture, and they can give you personalized guidance. I want to end with something important, something honest. You can improve your circulation at any age. I've seen 80-year-olds with better circulation than 50-year-olds because they took it seriously. But you also can't turn back the clock entirely. If you have decades of cardiovascular habits behind you, you're not going to reverse all of that in a month. What you can do is prevent further decline. You can improve from where you are right now. You can feel better. You can have more energy. You can move more freely. You can enjoy your life more. And for most people, that's genuinely life-changing. The seniors I work with who get the best results aren't the ones looking for a miracle cure. They're the ones who say, "Okay, I'm going to take this seriously. I'm going to use the oils. I'm going to move every day. I'm going to drink enough water. I'm going to eat foods that support my circulation. And I'm going to stick with it for real." Those are the people whose leg swelling drops by half. Those are the people who call me 6 months later and say, "Dr. Sterling, I took a 2-mile walk yesterday and my legs felt great. I haven't been able to do that in 5 years." Those are the people who get their lives back. I'm offering you that same opportunity. It starts with a decision to prioritize this. It continues with consistent action, and it results in real, measurable improvements in how you feel. So here's what I want you to do. First, pick one of the oils I mentioned. Ginger is my top recommendation for most people. Second, get a good carrier oil to dilute it properly. Third, make the commitment to use it daily for at least 4 weeks. And fourth, add the lifestyle factors we talked about. daily movement, proper hydration, circulation-supporting foods, and elevation. Do that, and I genuinely believe you're going to feel a difference in your legs. You're going to feel lighter, more energetic, and more comfortable. And that matters because your legs are how you stay independent, how you stay mobile, how you stay engaged with the people and activities you love. Before starting any new health protocol, please consult with your healthcare provider, especially if you have existing medical conditions or take medications. This information is for educational purposes and is not a substitute for professional medical advice. If you found this helpful, please let me know in the comments. Tell me what oil you're going to try or share your own circulation struggles. I read the comments and I love hearing from you. And if you aren't subscribed yet, now's a great time. I'm putting out videos every week on senior health and wellness topics that'll help you feel your best as you age. Thanks for watching. Take care of those legs. They're what keep you going.